Good afternoon and welcome. I'd like to acknowledge the local custodians of the land on which we meet today and honour elders past, present and emerging. I'm Melissa Wilkinson from the education team with the Primary Health Network. Welcome. Thank you for joining us today. Just a quick reminder that Slido is available for questions. The code for that is #CCPHU. There will be a poll at the end of the session. We value your feedback and this is to give us an evaluation of questions that can be completed, so that feedback will be taken on board as well. Just a reminder to please make sure your mics are muted. And we have Catherine Turner, our Executive Manager from the Primary Health Network, here as well with us today to answer some questions. And I'd like to introduce Kat Taylor from the Public Health Unit with the Central Coast Public Health Unit. Over to you, Kat.
Oh, thanks everyone. Catherine, are you saying anything?
I was going to say thanks very much, Kat, for doing this so promptly for us. There have been increased activity, as we know, on the Central Coast and a lot of questions from around the region. We do have people dialed in from right across the PHN region, and Kat has graciously given us some time this afternoon to answer some questions that I think have been received and pass on some messages to give people the most up-to-date information that they have. Just to let people know, health pathways and patient info are being updated at least daily at the moment with plenty of information, and also all of the information around testing clinics that have been popped up or had their hours extended are also available on health pathways and patient info, and Mel might pop the link into Slido so people can save that somewhere they know where it is. But other than that, over to you, Kat.
Thank you, Catherine. All right, I'm just going to click show screen and hope this works.
I can see it.
Can I just get confirmation that's working? Great. Well, thanks again, everyone, and I'd like to acknowledge that we're meeting on Aboriginal country wherever we are, and pay my respects to elders past, present and emerging. So really this is just a very brief update to give kind of some hot epi on what's happening with the New South Wales situation. Obviously there's a lot of people that have questions, and so I really have just prepared a very brief update. There's not a lot of literature or evidence. It's really just the situation update on what's been happening in New South Wales. So everything was travelling very well. How much can change in a week? So things were shaping up very nicely for Christmas. This is basically an epidemic curve of what's been happening for the last couple of weeks, and you can see up until the 16th there had been no locally acquired cases for, I think it was maybe over 28 days. But then unfortunately and ominously on the 16th, 3 new local cases were notified. One of these was in a freight driver who worked at the airport, and another 2 were of unknown source, but in residents of Avalon. And since then, the subsequent public health investigation has turned up a lot more cases associated with that. So we've had a very busy last few days, particularly with the Public Health Network working overtime over the weekend to really respond to and interview all of those cases and try to get their close contacts into isolation as well. So you can see this is just by date of notification, so it's not actually by date of onset. Most of the people had onset sort of around the kind of 14th of December, 14th to 16th. And so a lot of the exposure times and venues are kind of located in that week of sort of the 11th to the 18th. But in terms of when the cases were notified, you can see there's been a huge sort of upswing in locally acquired, this is just the locally acquired cases in New South Wales. And so peaking kind of on Saturday with, I think it was 26 or so notified within a 24-hour period. But promisingly, it is looking like those new notifications are dropping off, and that's in the face of very increased testing rates. So that's sort of where things are up to at the moment, and we obviously continue to watch the situation very closely. I was just reflecting as I went to open a file that it came up with this warning: be careful, files from the internet can contain viruses. And I was thinking, wouldn't it be nice if people and venues came with that warning as well? But anyway, so we think that this probably all kicked off. A lot of the cases have been linked back to 2 events that happened on the northern beaches at venues, the Avalon Bowler and the Avalon RSL, which apparently are adjacent to one another, and there is often movement of people between those 2 areas. And so I think it's now around 83 cases have been linked to those venues, either directly or via secondary transmission. So obviously people that have been to those venues have been out and about, socialising and mixing in the lead up to Christmas, and there has been some onward kind of secondary and tertiary transmission from those people. But as I said, the contact tracers are putting in overtime. The public health network has surged amazingly, and there is a huge local response to getting ahead of that outbreak. So just looking more locally, on the Central Coast, we have had 2 confirmed cases, and both of these have been directly linked back to the Avalon cluster. So they were both there at the times and dates of interest. With those cases, there have been 3 close contacts on the coast that are quarantining as well in relation to those. But I guess in response to all of the additional surge requirements within the public health network, we have enacted an emergency response framework, and we're surging and assisting with New South Wales contact tracing work. So there's a huge amount of venues that need to be risk assessed. There's a huge amount of contacts that need to have their initial contact interview, as well as the ongoing care that's being provided to the cases and the contacts. And then also needing to maintain business as usual. So we continue to provide the usual PHU services of communicable disease follow-up. So, still lots of gastro activity in the area and bronchiolitis. Also with environmental health investigations and work, as well as immunisation advice. So the team is really putting in an amazing effort here, but we have activated an emergency response and stood up some surge capacity to assist with contact tracing. But it is still just 2 cases that are on the coast, and neither of these were acquired on the coast. Just a few other salient updates that may be of interest to this audience. So New South Wales Health took the decision in the light of the emerging situation to move to an amber alert after they'd gone back to green. So as of Friday, New South Wales Health had gone back into amber, and that's just a little kind of framework of what that looks like from the Clinical Excellence Commission. But the key points are for all patients and visitors to wear masks whilst in a health facility, all staff to mask within 1.5 metres of any patient, for people to pay close attention to physical distancing, enhanced hygiene, visitor screening, and exclusion of any symptomatic staff, and patients and visitors, of course. I would also add that that has been upgraded yesterday to a policy of universal masking in health facilities, so not just within 1.5 metres of patients. Now all people in New South Wales health facilities are being advised to wear masks at any time in the health facility. So that's the amber alert. There were also a raft of residential aged care restrictions that were rolled out statewide. I think they were sort of changed on Saturday and changed again on Sunday. But the current restrictions advise that until further notice, all staff and visitors must wear a mask, and that all aged care facilities across New South Wales must exclude visitors. So I know that this is a very challenging time. At the moment, that visitor exclusion policy is just until midnight on the 23rd, so we will see how things go and monitor the situation closely, but that is the current advice with aged care facilities. And then also from a policy perspective, a range of restrictions on movement and gathering were brought in again, really to assist with contact tracing work and to limit any ongoing community spread, because things got big very quickly due to a lot of people sort of going on as per pre-COVID times. So you'd be aware of the Northern Beaches order. So this is an order on residents of the Northern Beaches area, as well as people who stayed in the area during a particular period, that they are not to leave their house without reasonable excuse, which of course includes things like providing essential services. So that is in force from 19th of December until at least midnight of Wednesday, and will be reviewed. Now, there were also some changes announced over the weekend to Greater Sydney, Central Coast and Wollongong, and these were really restrictions on gathering, and also, I suppose, led to other jurisdictions such as Victoria and Queensland deciding to close borders or prevent entry from people in those areas, and also led to a lot of questions about, is Central Coast now a hotspot? As I said, the COVID situation is there are 2 cases, they're both in isolation and neither picked up their infection locally, but these restrictions on movement and gathering are really just expanded to that greater metropolitan area, acknowledging that, you know, people may have already, you know, had a lot of mixing and moving before this cluster had been adequately isolated. So obviously that's a precautionary approach. We don't have an end date on that at present, but those the key things for general practice are that it's back to 1 person per 4 square metres. So physical distancing is definitely back in place. And then lastly, obviously testing has been a big thing over the weekend. Long queues in the Northern Beaches. Our local services have been coping very well. You can see there were 400 tests done across the local health district yesterday, which is a mammoth effort for our services, but also in the context of, I think there were maybe 33,000 or so done across the whole state in a day. So there's been a lot of testing occurring. You can see that big spike at the end of the graph. And you may or may not be aware that a clinic has been stood up at Woy Woy to offer COVID testing through the LHD, but a lot of private pathology providers have also been increasing their hours, operating hours, and also locations. And I'm advised that the good team at Health Pathways are continuing to maintain a very current list of all of those testing facility options. So for your one-stop shop of where to direct patients for testing, see the Health Pathways website or visit the People Bank HNE-CCPHN website. So I will stop there. I think that's all that I actually had, just a brief thing to bring you all into the loop.
Thanks, Kat. It's Catherine. We don't have any specific questions that I can see on Slido. More some reminders about working together, and there's a nice comment saying thanks for the support and education, so that's nice. We did have some other questions yesterday in a different meeting that I was in from residential aged care around residential aged residents being allowed to leave and go out, and I wonder if you could just touch on that, because there were some questions about can they come out for lunch on Christmas Day, those sorts of things.
It's a good question, and I think, you know, to some extent we might cross that bridge when we come to it. You know, the restrictions may be revised, but at the moment it is until further notice. The current advice is I would really be discouraging that, just as I'd be, you know, discouraging regional travel at this point in time. Really, it's just such a dynamic situation that we really just need to sort of stay in place until we get on top of this thing. And certainly, you know, things are looking up, but it's still early days.
And similarly, if people are discharged from hospital into residential aged care, are you advising that they be isolated when they're admitted, or they'd obviously be tested before they left the hospital?
Look, that's a good question, and I think that's a point where there's been some sort of differing policies with different local health districts. So I might need to take that question on notice and get back to you on that.
Okay, sorry, I didn't mean to ask a hard question. Yeah.
Catherine, it's Jenny. There are quite a few questions that have come through GoTo webinar.
Oh, are there? Why can't I see those?
Are you happy for me to read a few of those out?
Yes, that'd be excellent. Thanks, Jenny. Will I try and work that out? Thank
The
you.
first one is, why are there such long lines at testing clinics in Sydney? Probably because there's been 44,000 people being tested. Is this likely to be a problem locally if numbers escalate?
Yeah, look, as I said, there's been a big surge in testing capacity, and I am not aware of any sort of local issues with movement through testing facilities. In relation to the management of people that have been contacts of the venues, that's a sort of point where New South Wales Health has decided to go quite hard and advise everybody to get tested who has been to these venues. And so there are instructions for people to test and isolate until they get a negative result for casual contact venues. Then, of course, there are the closer contact venues where people might have spent longer or a case may have been considered more infectious because of the setting. Those people are also advised to test, but they need to isolate for the full 14 days, irrespective of whether the test comes back positive or negative. So I think there's been a big sort of demand in testing. My understanding is there's, something like 7,000 close contacts identified. And I suppose this is what I was referring to in terms of the exponential nature of people socialising in the lead up to Christmas and then subsequently becoming cases. But yeah, so there's been a lot of people that have been instructed to get tested as part of contact tracing activities. And then secondly, I suppose there's been a lot of public concern about this cluster, which is possibly driving testing. And the other thing which happened sort of early on in the piece is I think there was a bit of a miscommunication about the instructions about Northern Beaches LGA, because at one point the advice seemed to suggest that anybody who had been in Northern Beaches or had visited Northern Beaches should get tested. That is not the advice, but that was thought to be the advice for around 24 hours. So that may have also caused a large kind of demand in testing.
Just on that, Kat, we know that there have been many hundreds of, probably a lot more than that now, people tested on the coast in the private facilities as well. And we have done a ring around, particularly of the GP respiratory clinics, to see whether we hear all the time that people have driven up from Sydney to have testing, and the feedback that we've had is there was a bit of that on Friday last week, but over the weekend and yesterday, they were all people from their own locations who are being tested. So we are monitoring that. Just there's not much anyone can do about it, but just so we get a bit of an idea. So the postcodes that people are reporting are local. Jenny, I can't see the question, so you'll have to be the.
That's fine. Is the 1 person per 4 square metre rule just in Sydney or all of New South Wales?
Yeah, so those restrictions apply to Greater Sydney, which includes the Central Coast. It either includes the Central Coast or they've said Greater Sydney and Central Coast, but either way, yes, Central Coast is part of that. It does not include Hunter New England.
Okay. Would a sentinel testing en masse be redone like previous at the Newcastle Stadium anytime soon?
So I don't believe that the stadium testing was, strictly speaking, sentinel testing. That was really just kind of a big push for additional testing. Sentinel testing is generally where you kind of identify a population that's like maybe the canary in the coal mine, and you test them repeatedly, even if they have no symptoms. And that is actually happening at the borders. So in in staff that are working in quarantine facilities, there's some requirements coming in for flight crew and those sorts of people that would have contact with people coming back from overseas. There is a program now of mass repeated testing of those people.
Okay. Do any pathology services provide COVID testing in the home? Do you know?
Sorry, my phone keeps ringing. Yes, I can't answer that. Maybe someone from Health Pathways can. I know at one stage there were some providers that were offering that, like Foresight, but I don't know about that currently.
It's Catherine. We take that one on notice, and we'll put an update on to the link that Kat's already spoken about with Health Pathways. I think it could be managed in the past. Certainly in residential aged care facilities, it can be managed, but I'm not sure how broadly available that is.
The Central Coast PC Respiratory Clinic is open every day. Someone's just wrote in and conducted 500 tests yesterday, so that's great. Recommendations for spirometry in low-risk areas.
That is a good question. I think that would probably mirror the recommendations under the previous Amber Alert. I'm so sorry. Yes, I think that would probably mirror the previous recommendations, if only just for this short time until the situation is better known. I mean, I think I'll have to take the question on notice and probably check with one of our infection control practitioners, but my personal advice would be that, you know, non-essential spirometry should be being deferred at this point in time.
Okay. Does the universal mask wearing in health facilities apply for staff interactions with each other? Example, common staff spaces, staff kitchens.
Yes, that's my understanding. Yeah, that is something that should be paid close attention to.
Does the Amber Alert apply for medical practice in Tamworth? No cases for 6 months, i.e. masks for all patients.
So the Amber Alert is set by the Clinical Excellence Commission, which is a New South Wales health thing. So it is a statewide directive. So yeah, I believe that's just a policy decision. Yep.
There doesn't seem to be any updates on where the Central Coast cases have been in regards to local shops, venues, etc. Is this because they're still interviewing them, or can we confirm they haven't been outside of their home and therefore don't pose a significant risk to locals?
Yep, great question. So all cases are interviewed as soon as they get notified, and so our public health unit has interviewed and conducted that risk assessment on those cases. There were some exposure sites related to the cases in Sydney. So they'd spent some time in Sydney whilst infectious, but then since coming to the coast, they've basically been in isolation. So there were a couple of very brief sort of public visits. One of the cases did catch the ferry, so that is actually on the alerts webpage. So the ferry from Palm Beach to Wagstaff. So the date and time is specified, but that was a 20-minute journey. The person sat outside and it was considered to be a casual contact, but it is listed on the venue's website. So I don't think I included that in my presentation, but New South Wales Health case alerts will give you that full list of venues, but there were no other locations on the coast that were considered to be of local risk.
Great. What are the rules regarding health staff who live in hotspot areas? Are they allowed to leave the area to attend work if they show negative COVID tests?
Yeah, look, it's a good question and one that our LHD is working through. I guess the first question is, what is the definition of a hotspot? So there is a public health order in place for the Northern Beaches, which people should not be leaving their home other than for essential reasons. Now, it could be argued that provision of healthcare or going to work is an essential reason. And I suppose individual health facilities are then making risk assessments in terms of, you know, whether that person can be redeployed or on leave or working from home rather than actually coming in. And I suppose then if that person is deemed a critical worker, then some risk mitigation may be considered in the form of, you know, masking, although we are now at universal masking anyway. And yeah, I suppose other risk mitigation strategies around that person.
If staff from our GP practice travel to Sydney for Christmas...
Oh, sorry, I would clarify. Sorry, I just mentioned as well, if they've been to one of the venues that says, you know, you need to isolate for 14 days, then they definitely should not be coming to work. they should be isolating at home and getting tested as per New South Wales Health recommendations.
If staff from our GP practice travel to Sydney for Christmas, should they be self-isolating and be tested on return?
So at this point in time, we don't have any advice to that effect. However, we are discouraging non-essential travel. Yeah, we are asking people to reconsider the need to travel to Sydney.
Is temperature testing also part of the Amber Alert?
So entry screening is part of all of the entry screening is recommended across the full spectrum of, I guess, what COVID normal now looks like. I suppose temperature screening has always been one of those slightly vexed issues in that it's not necessarily, well, it's not a very sensitive way of detecting and excluding people who are potentially infectious. So obviously COVID cases can be infectious before they have any symptoms, and there's a significant proportion of COVID positive patients that do not have a fever. So I suppose it's sort of an individual facility decision as to whether temperature screening is implemented, but certainly entry screening, asking about symptoms, and also asking about travel to any of the identified locations is very strongly recommended.
Jenny, I might ask, I'm just note the time, I might just ask, there's a question here that has come through on Slido, Kat, which is, how will the EDs cope with COVID-19 higher risk, given the increasing numbers of respiratory virus presentations already with increased RSV across the region?
It's a good question. Interestingly, so we have, incident management team meetings daily now, and interestingly, it seems that ED presentations have been down since all of this has started off again. But no, it is a good question in terms of how EDs will and can manage, and probably not one that I'm in a position to answer, but I can take that on notice.
I guess it's a problem that's been increasing over recent weeks, isn't it, that one? Jenny, is there any last couple of questions there for Kat while we have her?
Yes, there are.
We might have to answer some of these offline, but yeah, carry on.
If we might just have time for maybe two more. What is the current plan for a positive case in an aged care facility?
Yep, so there's a New South Wales Health Incident Action Plan for cases in aged care facilities, and there have actually, so with this Avalon cluster, there have been some cases in residential style facilities, not actually care facilities, independent living. And so, yeah, there is a kind of task force that gets stood up in response to that. So that is a situation that would be acted on very swiftly. There is also a arrangement with Sonic Pathology to be able to deploy to rapidly test all of the residents and staff in a facility. So there are some established protocols for responding to cases in facilities.
Kat, if I can just add to that, we know all the facilities are different and have different arrangements and are owned by different people, and so we continue to encourage GPs who work in the facility to speak to the facility about what their individual plans are and what role they would like the GP to play, or what role the GP is able to play in the event of a positive outbreak. And we ask both the facilities and the GPs to continue to have that conversation so that they're all alert and aware of what the outbreak management plans are.
Okay, so have you got time for one more question?
Sure.
Only if it's an easy one.
What is the advice to the public coming to the Central Coast?
As I said, travel is being strongly discouraged at this stage. Obviously, with a lot of movement, I mean, we've already heard of people related to the Avalon cluster going to Queensland and going to Victoria. So, I mean, certainly anybody that's on the Northern Beaches border should not be undertaking this kind of travel. yes, we would sort of be discouraging movement generally, either from here to there or there to here. We do also have our environmental health team that are working closely with tourist organisations, caravan parks, businesses in our area as well, and they've all got COVID safety plans, and they're also implementing measures in terms of screening people for where they're coming from and symptoms. So there are a whole range of actions happening in place to that. Yeah, but we would prefer that things don't come up the M1.
I think we've got to the end of our time, so there probably are some other questions there, so we'll have a look at see which ones of those we might be able to answer and send back out if we can. There's this record. This will be recorded. This has been recorded, and Mel, I believe we're sending the link out, or we can send the link out later today. So for the people who've not been able to attend, there's that. The PHN has an emergency operations centre stood up to assist the LHD and the whole system as best we can over this time. And we're also, ready and willing and able to take further questions or to relay them to both the PHUs, and I know we can assist you with getting information out as best as we can. And again, we are so blessed in this region with both the quality and the accessibility that we have to the public health physicians right across the region, and Kat's a great example of that, and reached out to us and said, would it be a good idea if I did this today? So we really thank her for her time, and yeah, I suspect there'll be lots more questions. I know there's some here on Slido we haven't answered. We'll do our best to get those answers up there so people can move on. But yeah, we're all going to have to make some changes over the next few days or weeks, and yeah, I guess the message is the same. Stay safe, follow the instructions, and yeah, stay alert and stay informed. So unless you've got anything else, Kat, we'll sign off, I think.
No, thanks very much, everyone.
Thanks again for your time.
Thank you, Catherine. Thank you, Kat. And thank you to the whole team for pulling together today in such a quick and timely manner. It's an amazing response. So that's really appreciated. Thank you for your time this afternoon. Have a beautiful Christmas. Stay safe, everybody, and relax with family and friends. Take care.
Oh.